So thank you very much to our team of experts for that comprehensive information to share with the people of our province, the science behind everything we are doing, and also the need for us to shift when we move into the next phase. I just want to, as I conclude, just draw to your attention some of the big storylines on our data today, in addition to what you have already have. We want to say that Gauteng remains the epicenter. We want to say that. Although the surge has slowed down, the storm has slowed down, but we still regard ourselves, just by number of cases, confirmed cases, we still have the largest. The only difference is that someone is tampering with the screen there. So the only difference is that over the last few days, in terms of daily cases, KZN has got more daily cases than us. But we still regard ourselves, we want to conduct ourselves and behave as the epicenter and do everything because of the size of population here, the densities, and all the special issues that Gillian dealt with. We still want to make sure that we conduct ourselves. Don't want to say that the epicenter is somewhere else. We want to conduct ourselves as such. So part of that, the news storyline is that we have, I want that slide that shows 78% of recoveries. The recoveries, no, this back, no way. No, the provincial recoveries. This is the one I'm looking for. It is very important to understand the clinical issues raised by Prof Mlauzi. We always interested in how many people who have been infected are recovering, of course, versus those who have succumbed to COVID. But when we have more recoveries, it's a good thing for us. Those recoveries include healthcare workers. There was a period when I was COVID positive, interacting with healthcare workers in my area where I lived, where they were also reporting that half of the healthcare workers are not at work because they themselves are COVID positive. So recoveries are good for the population. So 78% recoveries this week is good for the population, but it's also good for our healthcare workers. It means there are more healthcare workers who are back at work. I always use the example of my area and region A in Johannesburg. I always use that example when I interact with the nurses and the doctors there to find out from them. So how many are you now? And they say, no, a lot of our colleagues who at some point in June who could not work and we were overburdened, a lot of those colleagues are now back. We are able to cope. So the story of recoveries is very important, but tribute goes to our healthcare workers because these recoveries happen out of the hard work of the healthcare workers. Fewer active cases. The decline in active cases is always important. I have had complaints from people who are watching this at home. They say, but when you speak, Premier, about these graphs, we don't see them. But I want to say that that green graph of recoveries, when it goes up, it's very, very important for us. And then the active cases, when the graph of active cases, that red graph goes down, It's also very important for us. So as we speak now, in the national figures, you will see we have fewer active cases than KwaZulu-Natal as a result of the daily increases. And I listened to the Premier yesterday saying to the people of KwaZulu-Natal, the storm is here. This is the message you remember we have in June, July, we were saying the same thing. People mustn't take this for granted. So there's positive news that the clinicians are talking about, that the modeling team is talking about. We've got to say, where are they happening? There's also observance that more people are responding to non-pharmaceutical measures. You remember we always complain, people don't comply. Those things around parties and marches and funerals, we've got more compliance. This is tribute to the people of Gauteng. We can only make this progress if the people take this defense of themselves and their immediate family members into their own hands by wearing masks, by avoiding doing all the things. So we have fewer active cases, but we still have the largest number of confirmed cases. You will see that in the last few days, we have also been recording the daily number of cases has been going down quite significantly in the last few days. That's a good story. But we are not out of the woods. This is a message I truly want to send out. The storm has not passed. It has just slowed down. And it may be protracted in a sense that the modeling team now says confirmed. Instead of just thinking September, we are going to have to keep fighting much longer because it's slower, the curve is more elongated, going over a longer period of time, which basically means we need to be more resilient. We must hold on. We must continue to do these things we were doing. And from Prof. Mlauzi saying that, in fact, they have more positive effects. They have more positive effects also on just general health and well-being. Social distancing and wearing masks, washing hands, sanitizing helps us beyond COVID. So we don't want, so as we go through this period, we want to re-emphasize to the people of our province, let's maintain vigilance, and we want to increase the level of community mobilization.
For more, go to ewn.co.za.